Hello, everybody. This is Dr. Neha Gupta from Giggles Clinics and My Own Space. And today we are going to talk about a very important topic, actually. We know that many kids can talk, many kids can answer, but they do not have initiation of conversation. So, what can be the various factors, why the child is not initiating the conversation or initiating any communication, and what can we do about it? So let's look into such factors. Okay. So first and foremost, a child who is not able to initiate the conversation, first see how are the sensory issues of the child, how aware the child is towards self and the environment. So a child who has good self and environmental awareness, there are higher chances that the child will be able to initiate the conversation, because a child who's having poor environmental awareness will be busy just processing the sensory stimuli from the environment. Something visual happening, something auditory happening, or he's running around to get the vestibular stimuli, or he's just doing something to give himself that stimuli. Or if he has the stimuli in the environment, he's trying to process it and make sense of it, integrate it, and he's just busy doing that. So a child who's busy just processing the sensory stimuli cannot initiate a conversation. It's not possible for him to do multitasking at the same time. Okay, so first and foremost, see that initiation of conversation needs environmental awareness. Also, uh, it's not necessary that the child has to be verbal to initiate a conversation. If the child has good joint attention, so joint attention also plays a huge role for the initiation of conversation. So a child having good joint attention, even though not verbal, but probably see something and wants to ask you that what this thing is. So he might just point to a thing and look at you expectantly, expecting you to answer the thing that what is this? He might not be able to say it, but if the child is able to point and look back to you, wait for your response. This is social joint attention. So you know that there is an initiation of conversation from the child's side, even though it is non-verbal. So not all initiations are verbal. And if that the child is doing, that's very good and encourage it. Another thing that can hamper the initiation is getting their demands met in an alternative way. So many times we see if the children are non-verbal or minimally verbal, they would choose the way of probably crying or throwing a tantrum and get their demands met. So where is the need to talk? Right? So if we it's not that we have to make them frustrated till they say something and then we give them the thing, but we have to tackle it in a way that we ignore sometimes, we give them words, sometimes we start demanding with them that we give the first letter of the sound, or if the child can talk, prompt him, but at the same time do the prompt fading as well. Okay, so if the child is getting his demands met through an alternative way, then it also hampers initiation. Even the children have difficulty developing need based speech. Another thing that affects initiation is lack of motivation. A child who's not internally motivated, I'm not talking about external motivation, a child who's not internally motivated will have difficulty initiating communications, because I have no desire to talk. Why should I talk? For what should I talk? So why that happens is because either I don't have enough things to talk about. I just I have my basic needs which are met on time, so I don't have anything to talk about. There is no motivation as a social being, as human beings. Talking is self reinforcing and talking is self motivating for us. We talk to our parents, we talk to our families, we talk to our friends, and that exchange of information, the exchange of emotions helps to develop a social bond, and that itself is self motivating for us. But for our kids, this self motivation is not existing at the initial stages. Eventually it happens, but initially it is not there, so that also prevents them from initiating. Another major factor that happens is using external reinforcers or the tangible reinforcers for a very long time. So in that case, the child tends to lose internal motivation to talk. Unless you show something eatable, unless you show some toy, the child is not going to say. So even if he is hungry and he wants to say, I want to eat, you will first show him a piece of, favorite eatable or favorite toy, so that he will come up with the words. So this dependency of external motivation is also one factor that hampers the initiation of conversation. So we need to fade that thing as well. Another thing, like I was talking, is prompt dependency. So use of reinforcer is one thing that hampers. Prompt dependency is another thing. Now prompts can be given in different ways. Prompts can be like, the child is capable of saying, I want to go out. Okay, so he's just looking at you, and every time you've been doing this, that I want repetition of single words, and you're doing this for a very very long time, so the child just looks at you, that you say, I repeat. So once the child starts coming up with a single word or two words, you need to start fading your prompts, so that the child can start coming up with a sentence or two word phrases or three word phrases on his own. Also, prompt dependency can be in the form of questioning. So many times we have seen, to get the speech, to get the language, we start with a lot of questioning from the children, and which is very, which is, which forms a barrier in initiation of conversation. Because with a lot of questioning, the child gets this idea in his head that unless I'm asked something, I'm not supposed to talk. So I have to talk when I'm asked something. Without asking, how can I talk? So unless you ask me, what do you want? I can't tell you I want this. Unless you ask me, where is this thing? I'm not going to answer. So from the initial stages, please try that you go for more of statements. Even if you want to ask, what is this? So instead of asking, what is this? You can go for, this is, okay, pen. So this becomes your closure technique. So the child completes the statement, and it is more descriptive in nature, and it is more open for further communication. Once you ask, what is this? Now you have to ask another question. What do we do with this? What is the color of this? So unless you ask this, the child is not going to answer or not going to talk further. But if I'm doing it in a way like, this is pen. Yes, this is a blue pen. And we write with a pen. Do you have a pen? I have 4 pens. How many you have? So with little bit of questioning is fine. But this is happening when we are having a communication going on. But for a child who has been dependent on questions for a very, very long time, or not even a long time, from beginning, if you have trained the child to talk when he or she is questioned, will have difficulty initiating, because he has never done it that way. So if you change your method from questioning to description, you will see a good amount of change. Then another thing is limited interests. So a child, why do we need to talk? Why does a small child need to talk? Because usually he needs something. He wants to eat something. He wants to go somewhere. He wants to play with something. So if the child does not have a wide variety of interests, where is the scope to talk? So it's our duty as parents to widen the scope of their interests. Don't think that my child did not show interest in this particular, at this particular time, he did not show interest, so I'm not going to present this activity at some later time. Do present a variety of activities. Do get involved with your child, even if it is messy play, even if it is something silly, as simple as bubbles. But get involved with your child. Develop and widen the interest area. Take him out. Let him see a variety of places, not just the park. Take him out to malls, take him out to restaurants, take him out to relatives, let him get introduced to them. So increase the exposure of the child to the outer environment, to the people, to the different variety of toys, so that he has more chances to try and communicate to you, because there are things to talk. Okay, so create the opportunities. Plus, in our routine life, there are very limited opportunities where we talk, we get to talk. So the child wants to eat, he comes up and asks you, I want to eat something. So create your schedule in a way that you get time to get involved with the child as a playmate, not as a parent or as a study buddy. So something that you can do more than your routine things. So the child gets more opportunities to connect with you, to talk to you. If he can cooperate in play dates, start arranging that. So, start with your smaller group play dates, maybe 2 kids, 3 kids, or take him to some indoor play zones, or take him to some daycare if there's nearby where there are kids. So maybe the child is not able to interact straight away in peer groups. So make him interact first with you, then with older family members, and with older kids, and then with the peers. Okay, that is another cycle. But what I'm talking about here is create opportunities for the child. So he will have, if he has widen interest areas, there will be more chances. And do some activities, watch a movie together, watch a YouTube cartoon together, describe the cartoon so that he or she has more chances to talk to you. Another factor that leads to less initiation of conversation is the parent expectation. So sometimes the moment the child starts to say something, we are like expecting too much and we burden the child with our expectations. And that overwhelms the child and he goes into a shutdown mode. He is not interested in talking anymore. Okay, so when your child starts talking, be more encouraging. You don't have to say every time for encouraging. Your nods, your facial expressions, they can also work in equally good way. So encourage your child to talk more, come up with words more. Wait for him to come up with for words more. As soon as he starts talking, don't try to feed words into his mouth. Wait for a few seconds. It's all right. He's just starting to talk. He needs to put the words together. He has to retrieve, process, and make a sentence. So it will take time. Give him that time. Plus, even if the sentence he said or the words he said are not exactly what they should be, or if there is some mistake, so don't go and jump and correct it that very time. The process of overcorrection is also very demotivating to the child, and it leads to less self-esteem, and they lose their self-esteem, they lose their confidence in the process. So try that you encourage more, and you wait more, and you give prompts in a decreasing manner. So if a child was dependent on verbal prompts, reduce it to gestural, reduce it to your eye looks, your eye gaze, and then go on like that. Okay. So these are few factors, if taken care of, can help in initiation of communication from your child's end. So I hope you can implement, and some of it might be useful to you. Thank you very much.